Hi, I'm Sam English, founder and CEO of AttentionPoint. Welcome to our webinar today on technology and ADHD assessments. Today we're going to be talking about best practice ADHD assessments, rating scales for diagnosing ADHD, and the entire current assessment process. We're also going to talk about how technology can be applied to assessing ADHD and the benefits of that. We're also going to discuss a specific example of an internet portal that was built at Cincinnati Children's Hospital. And then, of course, we'll talk about DefiniPoint. ADHD, as you know, is a common neurobehavioral disorder, and in fact, it's seen in about 10% currently of all school-age children. The most recent numbers from the Center for Disease Control has that at about 6 million, or 10% of the school-age population. And the rate of diagnosis is increasing at more than 5%. The direct cost of an individual ADHD diagnosis on an annual basis is $6,000. Best practice ADHD diagnosis relies on DSM criteria, and in fact the DSM-5 has just been updated and recently released. Those criteria are based on the frequency and severity of ADHD symptoms. Now, those symptoms, the information, observations for those symptoms, come from parents, teachers, as well as the clinician. To gather that information from parents and teachers utilizes standardized rating scales. And in fact, the American Academy of Pediatrics, as well as the American Academy of Child and Adolescent Psychiatry, both recommend as best practice the use of standardized rating scales to gather this information from both the home and the school setting. ADHD rating scales have been around for quite some time, and in fact they've evolved quite a bit over the last 20 years. They're based primarily on DSM criteria, and here you can see a list of some of the more commonly used rating scales. Because they've been developed prior to the internet and have evolved over the last 20 years, they're still mostly paper and pencil process. In an ideal world, we'd be able to easily gather information from multiple informants, multiple parents and teachers involved in evaluation of ADHD. Unfortunately, the current paper and pencil process is cumbersome. It takes a lot of time and a lot of effort. It starts with the clinician handing a packet of information to the parent, rating scales, ask them to complete the information, as well as pass it along to the teachers to get their input into the process. The parents and teachers complete the rating scales. They then send the rating scales back to the clinician's office. Unfortunately, they don't always get back in a timely manner, and so the clinician or the office then has to follow up to track down the missing information. Once the rating scales do get back to the office, they're then scored by the clinician or by the office staff. The data is then interpreted by the clinician and a report prepared summarizing the information. And unfortunately, as you can see, this is quite a intensive process for the clinician and the office staff. Because of the paper and pencil process that's currently used, the information does not always get back, and unfortunately this results in clinicians having only partial information. So now we're going to talk about how technology can be used to solve some of these problems with ADHD assessments. We use technology in our everyday lives. 63 million Americans are currently banking online. And last year, 167 million Americans shopped online. Increasingly, individuals are getting information about healthcare from the internet, and in fact, 80% of internet users were looking for health information. When we look at the increase of internet users over time, and pay particular attention to the timing here, so rating scales being used for 20 years, right? So now we're looking at 95 when only 14% of adults were using the internet, contrasted with 2012 where about 80% of individuals were actually using the internet. When we look a little bit more carefully at the numbers underneath this by age bracket, as you can imagine, older individuals use the internet less frequently, contrasted with younger Americans. Parents in the age range of children being diagnosed with ADHD, evaluated for ADHD, are in the 89 to 94% bracket of using the internet. So they use the internet quite frequently. Not surprisingly, teachers use the internet in everyday classrooms, and 93% of them have computers in the classroom and have internet in the classroom. 97% of teachers have access to their school email at home and are able to get communications at home just as easily as at school. Because parents and teachers are already using the internet frequently, there's a great opportunity to improve the ADHD assessment process by web enabling ADHD rating scales. So by administering these online, makes it much more convenient for the parents, teachers, and the clinicians. Also saves significant time to the clinician by automating the process. Ultimately, this results in a higher return rate, as well as actually increasing the time to getting the information back. By simplifying the entire process, this can be used not only for the initial evaluations, but also for the follow-up evaluations. Here's a study that was published a couple of years ago in Pediatrics. In Cincinnati Children's Hospital, they built an internet portal to web enable the communication between parents, teachers, and in this case, pediatricians on ADHD rating scales. What they found was that it indeed promoted best practice, getting information from multiple informants from both home and school settings to inform the initial evaluations as well as ongoing management. The portal resulted in higher return rates and faster return of the information back to the pediatricians. In fact, from the parents and teachers, they got the information back in 2 to 3 days and at greater than 80% return rate. Let's dive into the data just a little bit to illustrate the point. So at the baseline, before they implemented the internet portal system, they were getting information from parents in only about 20% of their ADHD assessments, only from teachers at about 14% of the assessments. Once the internet portal was implemented in 6 months, the rate had gone up to 40% for the parents and greater than about 36% for the teachers. Ultimately, over a 15-month period, it increased up to 70% of the assessments with information from parents and about 50% of those from teachers. So they were able to more than triple the number of assessments that had information from parents and teachers as part of the evaluation. On an ongoing basis, to manage patients once diagnosed with ADHD, when they did a chart review, what they found was that there were no cases of actually having information or documentation of information from parents and teachers about the ADHD symptoms of the child. So when they implemented this portal system, they were then able to track that information, and within 6 months they were able to get that in about 50% of the cases from parents and about 40% of the cases for the teachers. Over the 15-month period, it dropped slightly off to about 30% and leveled out right there. As you can imagine, in a pediatric practice, that first, the initial evaluation period, particularly with medication management, dosing and titration, fairly intensive process. So parents and teachers were actively engaged in that before it then leveled off at about 30%. But again, they went from baseline of not having this information to having this information in a relatively short period of time. Now that was at Cincinnati Children's Hospital, which is built for their pediatricians. What we've done is we've built DefiniPoint, which actually extends this even further, and we also incorporate additional assessment tools into the process. How does DefiniPoint use technology? DefiniPoint is web-based. There's no application download. There's no software updates needed. You don't have to have a special dedicated computer. Any web-enabled device will actually work. DefiniPoint is HIPAA compliant, so it's important that to note that we take security seriously and protect health information. The information can be accessed anywhere 24/7 as long as there's web connectivity. There's also an email system that's built in to the platform. Scoring is automatically generated online, as well as are the reports. We're platform independent, works well on Apple system as well as Android system. Anything that supports a 256 secure connection, web-enabled browser, desktop computer, iPad, tablet, or smartphone. And we also have a mobile version of DefiniPoint specifically designed for the smartphone. How does this work? At the end of the day, it connects the clinician, parents, and the teachers together. Notification emails are sent when action needs to be taken or information needs to be shared. That then stimulates the parent, teacher, or the clinician to log in to the secure system and find out about what's happening in the process. The paper and pencil process, as we discussed earlier, is cumbersome and time-consuming, contrasted with DefiniPoint, which automates the process, resulting in the clinician on the front end only having to come in, assign the rating scale, and then picking up the results and the reports on the back end. Emails are automatically sent to parents and teachers, letting them know about the invitation, letting them know about the rating scale to be completed. They log in to the secure website, provide that information online. The rating scales are automatically scored, results integrated, and the reports are generated. If they forget to log in, DefiniPoint sends them reminders throughout the entire process, and an alert is sent to the clinician when the information is back and the results are ready. Because DefiniPoint is simple and convenient, what actually happens is the amount of information is significantly greater than with paper and pencil process. So here you can actually see what happens using DefiniPoint is that you can get more information from more informants with actually less work. Right now, clinicians, particularly psychologists that are using DefiniPoint, are getting the information back at a greater than 90% return rate, and they're getting the information in less than 4 days. At the end of the day, what we're talking about is gathering additional information to help you make the ADHD diagnosis and evaluate the ongoing outcomes. At the end of the day, this is about information to support your clinical judgment. Instruments inside of DefiniPoint, we have ADHD rating scales, we have impairment rating scales, and we have a medication monitoring tool. The ADHD rating scales utilize DSM-5 criteria. These are standardized, psychometrically validated scales. There's normative data that is available for them. We have versions that are appropriate for children, adolescents, as well as adults. The impairment rating scales can be used for evaluation of outcomes that assesses the ADHD symptoms on relationships around the child or individual. And then we also have a medication monitoring tool that looks at efficacy as well as symptoms. So at Attention Point, we're committed to taking technology that we use in everyday life and translating that into tools that can then be integrated to improve clinical practice. Well, thank you for your attention today. If you'd like more information, there's another webinar which focuses on the clinical application and benefits of DefiniPoint, and there's a webinar which delves into the instruments inside DefiniPoint. Of course, there are tutorials and frequently asked questions on the website, and we're always glad to answer any questions that you might have via email or phone. That information, that contact information, is available on our website. Thank you for your attention today, and if you have any questions, please contact us. Thank you.